Recording.
Hi, my name is Alan Venook. I'm a medical oncologist at the University of California, San Francisco, where I run the gastrointestinal oncology program. I'm here to talk to you today about young onset colorectal cancer, this new and really frightening problem we're dealing with across the globe. Historically, colon and rectal cancer occur in people in the ages of 60 to 70. It's really long been a disease of the so-called elderly. And it's one of the reasons we can successfully screen for it and eliminate and have eliminated a lot of these cancers is that they develop in polyps. And if we start doing colonoscopy at the age of 50 in the average adult, you can detect a polyp before it turns into cancer. It takes 3 to 8 years to do that. And so by endorsing either colonoscopic screening, which is the most effective, or in some programs, they might do looking for fecal occult blood or blood in the stool, which is a sign of a polyp that could be leaking blood. With either of those strategies, you find cancers earlier than we would otherwise, and really can cure patients most of the time. So that's the good news, and the incidence of colorectal cancer has been decreasing for decades. The problem is that there's another population of patients where the incidence is increasing, and that's in people below the age of 50. It tends to be women a little bit more than men, but not overwhelmingly so. It tends to be people of color, African Americans and Latinos in particular, are more likely to suffer earlier colorectal cancer than others. Uh, by earlier, we're talking some patients as early as 30 or 35 years of age, even up to 45 or 50. The challenge, though, is how do we find these early enough to cure the disease, as opposed to people with polyps who develop cancer or older people. We can cure the disease because we find it early enough. Patients in the younger age group tend to have symptoms, tend to have problems for quite a while before their physicians or they get suspicious that they may have colon cancer. And therein lies the rub. People who are diagnosed with young onset colorectal cancer tend to have more advanced disease, and it is often incurable. We don't know why that is. We don't know why this is changing its age distribution. Is it the microbiome related to diet or environment? Is it exercise? Is it genetics? It may be a mix of all of those things. Certainly, no one feature tends to stand out right now. So, we and others are actively doing aggressive research, both trying to figure out if we can characterize young onset colorectal cancer from a molecular and other features, determine who's at risk, and then develop some sort of screening strategy to find the disease earlier. That will be very difficult, though, because even with compliance of colorectal cancer screening in the age over the age of 50, we still miss some cases, and getting young people to be compliant with a colonoscopy, which is a risky procedure, is very unlikely. So we've got our cut out for us, and unfortunately, lots of patients and caregivers and families suffer because of this. Again, if you have any questions or interested in learning about research, you can certainly go online or be in touch with me. I'm at University of California, San Francisco. Thank you very much. Bye-bye.